Engaging with communities, John Allen is joining us now to introduce his configuration of speakers, which has evolved slightly from the program. And John is Associate Professor, former Executive Director of Mental Health, Alcohol and Other Drugs Branch with Queensland Health, was Chief Psychiatrist in Queensland and New South Wales. And what I love about John is that he could continue to exist in a particular type of silo, and he has actively chosen throughout his career to not do that and to be part of a wide and evolving intersectional community. So thanks to John for his leadership.
Thank you very much. And I'm now officially retired from all those jobs, so I can do even worse things. That's great. So thank you. We're going to just move track a bit now. We're going to talk about some of those governance things and what we can get out of governance. And we've got some people representing the various commissions to talk to us about that. And we have 4 people to do that. One of the things is that all commissions throughout Australia are about different, so they all do different things. So I'm going to ask them all to do 3 questions. The first question is going to be, what does your commission do? That's 1 minute. What is your commission doing now to advance the physical health of people with mental illness, all the Equally Well agenda? That's 2 minutes. And then what would you like to do in the future, all right? So that all adds up to quite a number of minutes, and that's another 2 minutes. We're going to go through them. We're not going to do each of those questions at once. We're going to do the first couple. But I want them to be quick. That's why I'm just saying this now, because otherwise... Because we want to get to your discussions and the audience's view about what you think they might do as well, and to comment on what they say they're going to do as to what you think about its effectiveness. And, you know, be a constructive critic, because when you're in these jobs, and I know I've worked with many of these people very well over like 20 and 30 years, it is really important that we get the feedback, and that's what Equally Well is about. So that's what we're going to do. So here's our panel, all right? So first up, we've got a ring in, so we'll leave her. The next? No, we won't. So Catherine Lowry is a former New South Wales Mental Health Commissioner. She was there for 7 years and just recently retired from that job, and now actually does some part-time work for Equally Well. She and I were used to work in New South Wales Health together, looking out, building guidelines, and we used to go around and convince services to take seclusion rooms out of their plans. So we've got a great lifetime in human rights, right? Maureen Lewis is the Western Australian Mental Health Commissioner, and she's been there since 2023, but she told me in confession that she's one of the people whose names are in that document about Equally Well, and she was there at the start with us and Russell and others, and worked in the Mental Health Commission there, and I worked with her in New South Wales Health as well and various things, so she's got a great track record of that mental health reform. Deb Pratt, who I've also worked with in the Queensland Mental Health Commission, almost 30 years experience in influencing social change. She's a social worker. She's been involved in all those policy things around promotion, prevention, reform, addressing social determinants, service change, everything that, she'll talk about that. And then at the end, we have Philip Chabrel, who's from the South Australian Mental Health Commission, and he's the lived experience and governance leader in the mental health and community and wellbeing. And he works on engagement, participation, social change, but he's also got a great background in various senior roles around the place, around psychosocial services, psychosocial support, crisis support, suicide prevention and so on, before joining the Commission about 6 months or a few months ago. Is that right?
Yes, that's right.
Yeah, a few months ago. So he asked us to take him easy because he might not know everything, but we expect actually if you come from outside you'll know a lot because you're not inculcated in the nonsense that we're all in. So I'm going to go to this first question, which is, can you please explain what your commission does? You've got 1 minute to that, and then just follow on from that with 2 minutes about what is your commission doing to get us started. I'm going to start with Maureen.
Thanks.
Yeah.
Thank you, John. So what does my commission do? So the West Australian Commission is different to all other commissions in across Australia. We hold the funds for mental health, drug and alcohol across the entire state of Western Australia. We design the policy strategy in terms of drug and alcohol and mental health across the whole commission. And we're also host our big lived experience team, and we are the voice of the sector, voice of lived experience as well for Western Australia, with our amazing lived experience leaders across Western Australia. It's a huge job. We have $1.6 billion in terms of how we commit our funds, and there'll be no surprise to many of you here that at least $1 billion of that goes directly to public mental health services, so inpatient beds as well as community. We've got a brand new strategy about to be launched where you'll see the public mental health bit, which is super important, isn't what the strategy is all about. It's not about always more beds, more doctors, more nurses. We're really looking to have a shift into community-based services. We've got 600 million worth already, but we're looking to really shift that dial, early intervention, prevention, rather than building more and more of the same. So that's our new strategy, and we're hoping to get traction from government. It launches in December, hopefully this year. So very much looking forward to that and our new direction as well. We've got also suicide prevention framework we're about to launch. We just launched our eating disorders framework last year, and we're framework. But the frameworks are all great, aren't they? It's really about actually delivering on them, not having this beautiful document that you often see sits on the shelf. For us, with our new strategy, there'll be an annual implementation plan which we'll report and measure against and make sure we have delivered on what we said we would in that year. So really about holding the system to account. It's tricky because we're purchasing the services, but we actually don't deliver them. So it's trying to get that traction from a governance perspective, but we're not operational. We can't tell people what to do. Only through our contracting and procurement measures can we add those things in.
Thank you. Deb, we might move to you about the Queensland Commission.
Thank you, John. So yes, the Queensland Mental Health Commission is a bit different from the Western Australian Commission.
We haven't got any noise.
I think you have to press
it. Oh, do I have to press the button? Look at that. How's that?
That's good.
All
That's
right,
great.
excellent. First fail. The Queensland Mental Health Commission is different from the Western Australian Commission. We don't fund services. We don't hold money for mental health service delivery. We have a system reform focus across mental ill health, alcohol and other drugs concerns, and suicide prevention. We also have a role in building the mental health and wellbeing of all Queenslanders. So it's a really broad remit, as is other commissions as well. So we do that by, one of our roles is to lead the development of a whole of Queensland government strategic plan, mental health strategic plan. That's called Shifting Minds. We also have sub-plans under that. So we've got an alcohol and other drugs sub-plan, suicide prevention sub-plan, and a trauma strategy as well. So our role is to lead the development of that and then support the implementation of it and look at the accountability for that. So supporting implementation, but also monitoring progress and reporting on outcomes. We've also recently got some money through a recent inquiry in Queensland and some funding to do some extra things, so focused around lived living experience workforce development. We've also got some funding around leading the development of a public awareness anti-stigma campaign, some work around mental health and wellbeing investment. So lots of various things. The other thing that we do is we've recently, over the last couple of years, kind of taken holding the charge of the Queensland Suicide Register. So now that that's sitting with the Commission, we're really looking at how can we really maximise the impact of having that data and making it more useful in real time for people as well. Shall I stop it there? I think that's what the Commission does. Really.
That's your 1 minute so far.
So many things. I'll stop.
And in the physical health space?
And in the physical health space, well, I guess we're not doing anything specifically. However, we make sure that consideration of physical health is really infused across all things. So it's in Shifting Minds, so we've made sure that it's connected there so that there's an action around improving the physical health of people with mental health conditions. In the mental health and wellbeing space, we're really focusing on including physical health as a component of that. And I guess we work with other government agencies and across non-government agencies as well to try to elevate that in every different way that we can.
Great, thank you. And we might move on to South Australian Philip.
Is this working? It is. So yes, as per the introduction, I've not been with the Commission for a long time, so my perspectives perhaps maybe in the next section might be a little bit broader in terms of what I think we could do. Our commission, it'd be great to be WA, wouldn't it? We have, we're very, very small. We're nested within preventative health. Currently Tammy Allen is our mental health commissioner, and I'm sitting in for her. She's overseas at the e-mental health conference at the moment, and myself. So there's the couple of us, and we have just a shade less than 1% of WA's budget. So yeah, we're the little commission that could.
I'll send you a donation.
We'll take it. Look, a lot of our role is around communicating, around listening, and connecting. So a lot of Tammy's work is getting out, meeting people, coming up with ideas, but also drawing out that lived and living experience from a consumer perspective around their engagement with services, bringing that back into the commission and advising the minister. It's also around providing connections within the sector and cross services and finding links where they wouldn't perhaps naturally occur. And one of those areas that we're doing that is with an initiative we're standing up called Tall Trees. And that's a whole of community approach to the dismantling of stigma and discrimination. And that allows us to bring in emergency services, NGOs, local government, people from all walks of life. It's a whole of community approach. So we're looking at reaching out to hairdressers and bartenders and whomever wants to be involved in the program from that lived experience perspective, to work on projects to dismantle.
Getting people everywhere to be part of it.
Yeah.
Thank you, Philip. Just to let you know that we did originally have Jacqueline Gibson from the Mental Health and Wellbeing Commission in Victoria, who unfortunately had to pull out. And the reason I'm going to Kath last is she only just got volunteered 10 minutes ago to do this, so I want to let her collect her thoughts first. But I might head to Kath and talk about New South Wales.
Thanks, John. And, Victoria, this is, communication 101, how to answer and look professional when you've had 5 seconds to prepare. So thanks. Look, the New South Wales Mental Health Commission is established under legislation, and the role of the New South Wales Commission is to improve the mental health and wellbeing of everyone in New South Wales. So it takes that whole wellbeing, that whole community approach. It does that by doing 3 key things. One is reporting, and then monitoring, and then advocating for reform. So very much about doing collaborative, collective work on reviews of particular services. We've developed, the Commission has developed a suicide prevention framework, and in New South Wales, for those of you who may know, New South Wales now has new suicide prevention legislation, such as South Australia, and the Commission has now been tasked to oversight the rollout of the suicide prevention framework. That's a new role that they've been given, which is fantastic, because part of that framework has been a whole of health approach as the kind of bi-directional relationship with suicide risk, and that whole of health, mental health relationship. The other thing that is in the Commission's legislation in that whole of person approach is physical health. The things that the Commission has done in regards, we've worked and supported equally well on a number of projects. We've also supported the work of Jackie Curtis and her team in keeping body in mind, and one of the things that I always love to plug, and I will continue to do so, which is the Commission received about 4 4 years ago a Commonwealth grant to do a health literacy project. And the reason that I always want to talk about that is because obviously we've spoken about health literacy here, we've spoken about the health literacy of people and of the workplace, and that's exactly what this project was all about. It was a Commonwealth grant for New South Wales, New South Wales won, and it was now with the Commonwealth, and I always like to pester them about what have they done with it. But the key thing is about really understanding, and it was a very hugely consultative process. It included every single PHN in New South Wales, every local health network bar one, and the community managed sector and the lived experience sector. So it was a totally collaborative process, which meant that the health literacy could be understood by people who were not mental health clinicians, but having people come into their service who did have mental health issues, and vice versa. Mental health clinicians are better understanding physical health. And I think, you know, there are a lot of these little things that we do that we collaboratively bring together. And I don't know whether Equally Well has a link to that on their website, but I just think health literacy is something that's been echoed here quite a lot, and I think absolutely it's quite a fundamental thing in how we need to lift that gaze off the prescription pad, you know, right into those person's eyes, and to really understand and listen to what is important to them in their physical health and their mental health.
I remember we presented that really well at the conference in Sydney a couple of conferences ago, but we'll check the website that it's still there. So I'm going to move on now to my next question. It is short and sharp. Just keeping in, what I've asked them to do is keeping in mind the issue of physical health, people with mental illness, and the Equally Well agenda. What are the things that are, you know, in the system that are ripe for service enhancement? So what are the things that you would like to do that are hot on the press from the Commission's point of view to enhance that area in physical health? So I'll start with Maureen.
Thank you. So I did mention obviously the launch of our new strategy shortly. So it will be a key feature in our new strategy about physical health. Often gets ignored in strategies. So we'll make sure that that's a key feature in there. We've also just developed a brand new outcomes measurement framework to monitor the implementation of our new strategy. And again, physical health is a key domain in that area. So we'll actually start to tangibly be able to measure those things. We've also launched a vision early this year around, it's called CETA. It's not a bad document actually, but in terms it's about community treatment and emergency response and community support services, and it's how we're going to link all up together. So the person who's travelling in and out of different services, we've got a linkage with general health, physical health, and also for NGOs and all the services. So hopefully there'll be better communications between all of those services in terms of integration. These are strategies at the moment, so it's all gonna at the moment, but it's our vision to connect all those things up. We advocate very strongly to our ministers. I've got 2 ministers, so Minister for Health and Mental Health, and then we've also got a brand new preventative health minister, which gives us a great opportunity in Western Australia to be able to get in terms of a physical health perspective, in terms of how we can work very closely there as well. So there's a fair bit going on. The other thing I'll say for our Aboriginal communities in Western Australia, we work very closely. Our model is the social emotional wellbeing model, which of course physical health is at the heart as well as everything else of that as well. It's about everything, the whole being. So that's our preferred model. We've got 6 or 7 pilot sites across Western Australia, and we'll choose to grow them as well. So really that's where we're at the moment. There's always a lot more we can do as well. But we're hoping, we're just had a reset. We're all new and we're starting again, and it's really about trying to head in the direction to make sure all of these things are important. But as others have said, I was one of the founders along with Russell and others of Equally Well, stole it from our friends across the ditch in New Zealand. They were very happily let us use the name. And so it's very much front of mind. The other last little bit, which is critical actually, is the commissioning piece. We're lucky because we commission services. So it's put my mind to how we commission into the future. We've got a new commissioning framework, and to make sure that in contracts, in procurement and commissioning, that physical health is a key component of actually what people have to deliver and what we measure people against, and make sure that we are able to do that, because that it's key in the commissioning as well. So that's a few things.
Yeah. Thank you. And all you Western Australians, remember, she commissions the money, all right? So you be good to her. Deb.
Thanks. I also think that the commissioning side of things is a fundamental, system fix that we need to do, that it's very, very challenging, but the way that we fund things in silos is, it just, you know, makes it so difficult. And I think, you know, if we could put our heads together, you know, the role of the commissions, I think, could assist that. And I guess from a Queensland perspective and the Queensland Commission's perspective, you know, we're not holding the money for service delivery, but we really are trying to influence the way that things are done. So bringing, you know, and not just focusing on health, but looking at those broader social determinants of health and how we can get a better focus, you know, and really focusing on that prevention and early intervention. So, you know, generally for mental health and wellbeing across the community, but specifically for people with mental health conditions who may be at the start of their journey, and where if we could, you know, intervene earlier would make such a difference. And I guess from that government perspective, you know, trying to pitch that to government as an investor save type strategy, which is really difficult. I guess when, you know, governments are really looking at, you know, avoidable hospital admissions, for example, but that's a real, you know, that's something that I think in this space we could really make the argument for. I think there's also, you know, potential to upscale and build on the things that we know that work. You know, there's just so many pockets of excellence, but I think the system really struggles with how to build on that and scale it up. And I think, again, part of the Commission's role is to, I guess, seed innovative practice and evaluate and, you know, amplify the outcomes of things. So I think that that's something that the Commission is doing in various ways, but could focus on more. Additionally, I'll just make one more comment. You know, we're in Queensland, we're calling it refreshing Shifting Minds, which is the whole of government strategic plan. We've had a change of government in the last year, and we're really looking at how we can reset and refresh Shifting Minds so that it really speaks to the new government and its priorities. So it's continuing on the good work that's already been started, but really trying to nuance to what the new government is particularly interested in. And in this space, you know, obviously we'll continue to have a focus on improving physical health outcomes, but, you know, linking back to what I said before, I think it's really about pitching it at what's in it for government that government's really interested in, which is, you know, reducing costly services. And we really just need to boost up and show them how important investing in prevention and early intervention is.
Yeah, prevention and early intervention is very important. Now, Phil, we had a wonderful talk from your minister who said that you're doing great things. So tell us about some of those things you'd really like to do.
Thanks. Yeah, the minister. Well, firstly, I would say that a couple of the things that Tammy's been involved in have been social prescribing. That's just been some work being done through Flinders, and also some focus on overshadowing. So that's been something there. Now, the minister did outline some significant funding, and we've talked about a lot of different programs, the Mount Barker Head to Health work there that they're bringing, supporting physical health in, and other things through this. But a lot of the investment in the mental health budget has been around beds, and that's important. And we're sort of almost there in terms of the meeting that need in SA. But I think, just coming back to Russell's comment in the beginning of the conference around bridges, and we've got to get politicians of all stripes to like bridges. They love bridges, and you only have to drive around Adelaide and to see all the bridges that are going up. We have to get them to like different bridges. We have what, and this is more from my perspective than the Commission's. What I've been hearing through here is amazing, and it's been, even though there's a lot of lived experience around, it's been largely focused. I've heard a lot of stuff about GPs and making sure in those settings we're getting that connection or breaking down the silo between physical and mental health. I come to my work from a lived experience, and so my go-to is the person that's engaging in the support. And Where I've seen the most traction has been in psychosocial supports. We've got up over 400,000 people that are missing out on those nationally. In SA, we've got 19,000. It's great to see some of my old NEMI crew and Tom here today launching this health prompt. I remember using that in the Wellness Connect psychosocial group-based program. In that program and in other psychosocial programs around, there's great work being done by peer workers to support people around their context, around their physical and mental health. It's a holistic approach. I think there are amazing stories of recovery that come out of that. The impact, the change that can be made around somebody's mental health from their physical health being attended to, sometimes for the first time. So I won't drag on too much, but I think the investment into peer support and psychosocial supports would have a dramatic impact on those statistics.
And the opportunity to use that peer support to support both the physical and mental health and the emotional well-being of a person.
In psychosocial services, it is physical and mental health. It's not
Okay.
just mental health.
So they've overcome the Descartesian divide. That's good to hear.
Indeed. They've broken down that silo.
Good to hear. Maybe we will one day. Catherine, chains are off for you, so you can suggest what you think.
I can suggest anything.
Yeah.
Oh, that's excellent. So in New South Wales, they are writing a new strategy. Seems to be the season for writing a new strategy. So New South Wales Mental Health Commission is writing a new strategy. What I think I would like to see in that is a bit shaped by what the New South Wales Upper House has been doing recently. They've been quite interested in mental health. They did an inquiry into community mental health, and out of that there was very strong recommendations around improving integrated care. Very interested in what does holistic care look like, and wanted really practical examples, which actually also echoes a bit of our conversation that we had with the Productivity Commission, so that would be interesting as well. But I think trying to really do that reshaping of the system to actually fundamentally understand what an integrated care model looks like on the ground, to actually understand that it's more than just bringing individuals together. It's actually a culture. It's actually a culture change and a transformation. And I think that my hope for the Commission, given that it's almost 15 years old, is that it can be brave. And I think that's one of the things that would echo perhaps many of your work or your practice, and listening over these last day or two, is that you can be brave from wherever you are in your role. And I think as an organisation such as a Commission, they have that extra responsibility to step up and be brave. And I think for physical health of people with mental health issues, it is something that I actually ponder why, with so many stats, and we've seen all of those, why isn't that agenda driven forward? So that's what I would like to see the New South Wales Commission do. They've got an election coming up, in 18 months. I'm always thinking, nail it now, guys. And I think that's really important in all of this story about reform. We each are different, but we have that common agenda about what's important to our community. And I think that's the responsibility that a commission has.
Yeah, great. Thank you. Thank you to all the panel. There's a lot of ideas there. We're going to open up for questions.
Yeah, there's some great questions coming in.
Yeah.
So thank you so much. And I'll come to the room. I'll get to a couple on here, and then I'll wander around the room. So please pop your hand up. Every question is, you've got the commissioners here. Ask the questions. Okay. But just as a little point of celebration, Julian has said, speaking of peer workers, as of this morning, I'm now a qualified peer worker. Where are you? Congratulations. Rock on. Right. That's fabulous. Now, Dave Peters, quite a few people have ticked your question. I'm curious about whether the difference between this is for WA. I'm curious about whether the difference between holding the funding and commissioning in WA creates opportunities to offer longer term funding for services as opposed to most of the rest of Australia where funding is usually time limited and insecure. We frequently see pilot programs, yes we do, that don't seem to be further funded after the pilot, 18 to 24 month funding cycles for more mainstream NGO services and the roll-on effect on staff turnover, lack of job security, followed by consumers and carers getting access to support for an urgent need only to see the program finish or change, bringing a loss of trust, confidence and engagement. Speaking the truth, because I'll reinforce that, JD, I was wondering the same thing. The service I work in is a pilot. We just celebrated its third year of being open, which is nothing short of a miracle. Countless other pilots have not been so lucky. WA, have you been able to kind of take the reins of the piloting, endemic piloting in this sector?
So I'm an anti-piloter.
Oh!
So just letting you know. So
Staking a claim.
Since I came in to the Commission, I've had fights with Treasury around why are you piloting, unless it's some new idea about painting the room blue and we're all going to get well or whatever it is. I'm sorry, that these are evidence-based, proven programs and part of a system that we require. So I have inherited some pilots, but I am shifting away from pilots full stop. The other thing I'll say is my background is a health professional. Worked in the mental health system for many years. There's a huge inequity in our NGOs getting funding on short-term cycles when funding has been going on for, you know, some in the WA Commission, people have been funded 10, 15 years and still having to go through these ridiculous cycles, not recurrent funding. So I'm seeking to fix that in our new commissioning cycle that we're working through. And also, I honestly believe that, you know, you can educate Treasury and government and others to stop the pilot, unless it's something brand new that no one's heard of and we do need to test it and get the evidence. But I'm not a fan of pilots at all.
So what are you replacing them with?
So as in, if it's an evidence program, I put up a
Right.
budget bid, and basically this is about we need funding for this program. We're going to
And
roll
here's
it out
the
gradually.
evidence
And
to
here's
support
the
it.
evidence, and here it is.
Because 18 to 24 months is never enough to build proper evaluation.
But like, for example, I'll give you a good example.
So you can't build a case to continue
No.
the pilots.
I mean, a good example is in WA. We're just in the process of rolling out ambulance co-response, and there will be peer workers in that
Okay.
co-response team. It's across Australia. It's been working forever, and they want to do a pilot. Well, no, it's not a pilot. It's part of a system that we require. So it's really that education piece. The other thing is, I will say, as again, inherited so many hundreds of millions of grants, people on short-term grants, yet the programs have been running forever. That's going as well.
How to create trauma in a sector that's already traumatised.
So we're just in the process, this budget, whether we'll be successful or not, of shifting those grants, there's a lot of them, into permanent funding. So
This is great
that's
for
what we're
people to
trying do.
hear. Yeah. So, I mean, part of advocacy is also advocating against the piloting culture in this country. Terrible and very politicised as well, because different politicians get behind different pilots, don't they? Okay, so we're going to let's keep answers really tight because we've got a lot of questions, and I really want to move around the room. So over the other side of the room.
Does this one work?
Yep.
We had two over here, if that's okay.
Yeah, great. And maybe we could take them both in a row while you're over there. We'll take the questions.
Getman. I'm
and
a Palawa man that comes to you from Naarm in Victoria. I know you can't speak to the Victorian government. However, as a lived and living experienced consumer, an educator and an advocate, can you tell me how a consumer can have confidence in a commission that gets 16,000 complaints over a period of 12 years and doesn't make a single determination against the system? And also we have a mental health tribunal that can see a psychiatrist at 5 tribunal hearings in a day in a row where he's found to have been coercive and can continue to practice.
Okay.
How can consumers have confidence in commissions?
We don't have...
Thank you very much. I'll just take that question,
Take
actually.
on
But
notice,
I want
I think, because we don't have the Victorian Commissioner with us.
We don't?
No.
So, I mean, does anyone want to respond to that or pick up on that point that was made? It's an important point.
Yeah, and I think there are there's some internal...
But trust is an important
things
part
are
of the
happening
Commission.
in Victoria around that, but I don't know the details, so I can't give an answer to that.
Right, okay. I also just want to acknowledge that Victoria has just signed its first treaty with First Nations communities, and let's hope that has an impact. Okay. All right, interesting. Okay.
Take the next question.
If anyone wants to pick up on the question of trust and commissions, perhaps we can across the course of the conversation. Another question. Thank you.
Just thank you for sharing, first of all. The space that we work in, I just want to pick on the latter thread of braveness, and thank you for introducing that. Through the work we do, we know that braveness exists in conditions, and often, I guess what I wanted to ask the panel was, from your experiences, and this is maybe messages for commissioners in the room, for people that run, directors of services, etc. What are the conditions that you would love to see in those kinds of environments that enable people to step into their braveness more?
Who would like to pick that up? I won't grab all of them, but who? Tell me about courage and braveness. And
look, I mean, for me, I guess as a commissioner, as I said, I've been in the kind of mental health system for, I'm not going to tell you how many years because you'll know exactly how old I am. The hair dye does a great job. But I guess I've gone through just doing what I need to do, doing what I'm told to do, kind of, you go through the system from a young nurse all the way through and you're just going with things. Now I'm very more outspoken, not by the way, not in a way to annoy government because you'll get nothing. I've worked out how to influence in a different way by being the voice of many. And really, I'm a very, the way I'm talking now, I would speak the same to ministers or anybody because it's important to be honest and truthful, and you get that trust from them, that they trust in you in how you're speaking rather than, I've got many colleagues across other DGs and the agencies, and they can be very bureaucratic and hold themselves and not able to show a bit of themselves and things, and that's not my leadership style. It may not ever get me to be the DG of DPC or Treasury or something.
Who cares?
But this is me, and what I've found is with ministers, politicians, other government, then I have a lot of trust in them just by being myself and being honest.
That's an interesting point, isn't it? To be yourself and be strategic in how you deploy that.
And I just say, look, I spent 15 years in government too. And I think that there are two things that really work. One is if you're actually genuine about what you're representing, which means that if you've consulted with people and you have the voice of lived experience and the voice of your service people as well, and you're putting their ideas forward, that's one. And the second one, as we talked about a lot, is about evidence. If you can actually show the government that they will get a return by filling that gap with an evidence-based program, as Maureen says, then that's when you get so jumping up and down, being rude, will never get anywhere. And that's how we've worked as bureaucrats, isn't it? Yeah.
Some questions. Michael, peer lived experience workers are always spoken about in glowing terms. Are they ever going to get well-paid union representation and career pathways? And alongside that, M, what tangible differences have each of the commissions made to the experience of people with lived experience in their states? Slightly different questions. And Brooks adding not just peer workers, all people with lived experience. So, how do you... First one, about, lived experience workers are not a charity.
I might just start that. Thank you for the question. It's a really great question. I think at the Queensland Commission, we're doing a few things. I think all of the things that we fund, we...
Just bring the mic up a bit, yeah. Just closer to your mouth, yeah.
They say I'm the quietest one in my family.
That's not the mic for.
A couple of things. So first of all, the Queensland Commission recently released our commitment to partnering with people with lived and living experience. This is a public statement that we're making about the way that we want to work with people with lived and living experience in the way that we fund anything that we're funding, the way that we work, the way that we bring in the perspectives of people with lived and living experience to co-design, co-produce, co-lead together as much as possible. And we encourage, so this is how we're doing the work ourselves, but we're also encouraging others to use it also in a way that works for them. Anything that we fund, and unfortunately we don't have recurrent funding, and we do fund, we seed good ideas, we seed, evaluations and so on. we require anything that we're funding to partner with people with lived and living experience as part of that work, and we support them to do that so that it's in a genuine way. We've also received some funding through the mental health inquiry over the last few years to build the lived experience workforce, so we're doing a lot of initiatives there, and we're talking about lived experience workforces across mental health, AOD and suicide prevention as well.
Is part of building it also looking at payment?
Oh, absolutely. Yes. Yep, definitely. And we've also built the capacity of the lived experience team in the Commission itself. So we've got some designated positions in the Commission, including our Director of Lived and Living Experience, who sits on the executive leadership team, and a number of identified positions as well.
Okay.
Can I tap into
yes, please do.
That peer space as well? So within psychosocial services, from a South Australian perspective at least, peer workers, I'm going to go out on a limb and say, are generally paid the same as community mental health workers that work side by side with them in those psychosocial settings. So there's a parity there against with people that are using their lived experience in their practice and those that are not. A lot of organisations are tapping into the resources created through LELN, our Lived Experience Leadership and Advocacy Network, our peak in SA, and also the Mental Health Coalition for frameworks, and from nationally as well for frameworks, which provide some career pathways for people with lived experience. And I'd really suggest to any of the peers that are in the room today that to look around for where you want to work. Do your research into the organisations that are really doing some great work in this in terms of creating those pathways, and go to them. That will put pressure on other NGOs to lift, to create a value proposition.
Value proposition, yeah. It's a marketplace, isn't it? It's a workplace. Dave, you've just got some things that you've posted around this, and I'd love you to enunciate, to talk about it.
Thank you. Look, in relation to the idea of national representation, or even just having a union, having access to education, professional development, career pathways, we have, the Commonwealth has committed to funding for at least a 3-year association, which will then be required to be self-sufficient, or show that they can be self-sufficient, to continue to offer national representation, a consistent national practice guideline, scope of practice that allows people to sort of push back against job scope creep, and that sort of pushes that idea of equal work for equal pay. But that's just my hope. I don't know whether that's it's part of the grand sort of commission is calling for ideas on how that could happen, but it hasn't even closed. I think that's closed last week, so it's still very early days, and whoever gets the job will have a lot of hard work to do to try and professionalise lived experience work as a discipline.
Yeah, it was part of a national workforce initiative about 3 years ago, sponsored by the Commonwealth Government, led by the National Commission, and that prioritised peer workers and Aboriginal and Torres Strait Islander health workers in mental health as the two leading gaps in what we didn't have.
And this was reinforced by Liz. Not simply payment, needs to be meaningful career opportunities for lived experience people working in systemic advocacy, not just relying on volunteers and token honorariums. But that other question, which was, what tangible differences have each of the commissions made to the experience of people with lived experience in their states? Now, I know you want to answer that in about 15 minutes each, but you can't. But someone has said, for Liz also, because she's in Tassie, has said, I'd love to know this as a Tasmanian without a mental health commission. So this is good chance for you to say, give us a palpable sense in 30 seconds each. Is that okay, John? Yeah. Because it's a question that's come up.
Sure.
Thank you.
I'll start and have a go. What I will say is we've always got a long way to go since I've been working in this area, specifically in commissions. I get it right, I get it wrong, but each time I'm learning and trying to work with it. In the WA Commission, we have lived experience assistant commissioners, so as soon as I arrived, the first thing we wanted to do was elevate the voice of lived experience. They're remunerated very well and should be. There are experts and they work within the entire sector. We've also got lived experience teams like Queensland who are on various levels from directors downwards.
And for the wider lived experience community, what impact do you feel when you go to bed at night you're having?
So all those strategies, all those things I've mentioned to you, there is not one thing we do without consulting with lived experience. They are all... Now, we may not always be able to deliver on everything that's been requested and required, but every single strategy, document, policy, everything we do, we work with lived experience expertise and lived experience across the whole of Western Australia. Are we perfect? Absolutely not. And we've always got a long way to go.
Perfect's the enemy of the good, often anyway. Other comments from each? Phil, Kath?
I'd say very similarly. I think everything that we do is infused with lived experience. So, we're a strategic reform focused commission.
Bring the mic right up to your face.
God,
Thanks.
sorry.
Amplify. Claim
Stop
your
talking
voice.
with my hands. So all of our strategies as well, they have very strong lived experience focus in how they're developed. We have some really strong peaks in Queensland, so we support them in many different ways. The governance of all of our plans have a very strong lived experience element. We have our team who embed every lived experience into the way that we work as well, so they support the internal team as well. We're not perfect either. We've got a long way to go. We always will, but I believe we've got a very true commitment to working with people with living experience.
South Australia. It's tough.
So
One of you,
I come
two
to
of
my
you.
two of us.
What are you feeling?
Look, as I
in terms of
mentioned,
impact?
I come to my work with a lived experience. Tammy as well does everything she does from her lived experience perspective. So I can confidently say we're 100% lived experience. It's not that easy to say with two. It's hard to say with two.
And having
but
two commissioners,
yeah,
two people there, front and
yeah,
centre,
yeah.
public facing, that is impact.
Everything we do is through a lived experience lens. If we're looking to advise government, it's either something that we know it's on the shelf that we can draw from previous research, or we go straight out. The drought mental health funding in the SA, for example, when that came up, we went straight out to regional SA and drew that lived experience in, exactly what people wanted, and then that formed. We take that and we help shape that response. So that's an example of how we would do that.
New South Wales, you're not really able to comment in your role, but very briefly.
Well, just briefly, in New South Wales in our legislation, the Commissioner has to have lived experience as a carer or a Commissioner, and I had experience as a carer. As Deputy Commissioners, there were 7 and 2 of those had lived experience. But that's the structural thing. I think the thing for me that the Commission very much backed peer work, because that really is a culture change, and the culture change is about the experience of care, but also about engaging across all different government departments about why isn't there a person with lived experience of homelessness on this committee? I think asking those questions wherever you go and lifting that engagement, because then that will change that experience of care and outcome.
Being in every conversation. John, back to
I
you
think
to
just
control.
back to me. Some of us are old enough to remember a time when there weren't any commissions, and we recall the call for commissions. I think if you look at the success of the commissions, and they've been variable and up and down and had their flotation, the respect for lived experience that's come from that has been an enormous step that we wouldn't have got as far if we hadn't done that work. So I do think overall commissions have been helpful in that, but some of the times commissions don't have much money apart from Maureen, and it's an uphill battle against fights and bureaucrats like me to get the money to do what they want to do. So
where are the gaps?
Well, we're at the position where I think everybody actually recognises what we need to do, right? We're all committed to the lived experience stuff. Some places are better than that, and I'm really proud of the fact that I'm from Queensland and we're way ahead in the representation and payments and so on and organisation, but everybody could be there too, right? That's not me, that's individuals who've done that. And it's been, if you look at the services, they've got high levels of lived experience people working in their services. They're the ones who have the best change and they have the best satisfactions, and it's pretty clear. It's very clear. So it's just a funding issue now. It's not a debate issue anymore, as Maureen says.
Well, we'll wrap. Is that okay? Thank you, John.
Thank you. Thank you to the panel.
And thanks to the panel.